Are you struggling with joint pain that has persisted for months or even years? You might be dealing with osteoarthritis, a problem not just yours, shared by millions worldwide. In fact, over 700 million people have been diagnosed with osteoarthritis. Hi there, my name is Gustavo Alvarez. I am a orthopedic surgeon, expert in biological therapies and joint preservation procedures, and director and co-founder of Clinical Arthrosis. Let me tell you about David, a 50-year-old patient who had been experiencing knee pain for about 4 years. He believed it came from a childhood sport injury, a common thing among children and teenagers that often goes overlooked. In his initial assessment with an orthopedist, he was told that due to not seeking early treatment, he developed cartilage degeneration. In other words, osteoarthritis. Unfortunately, there aren't many options for him, and it is an irreversible problem. He was prescribed to use anti-inflammatories, lifestyle changes, and he was told that knee replacement should wait due to his age. Five medications, weight loss, and a walking routine, they saw no improvements. That's when he came to us. Upon reviewing his MRI and X-rays, we confirmed severe cartilage damage. The same explanation I gave him, I want to share with you through graphics. What osteoarthritis is, why it's challenging, what biological therapy entails, and why it could be the alternative you are looking for, backed by academic references. Usually, our body tries to carry out a regeneration process in the face of some damage. Normally, there are damage to a cell that activates an inflammatory cascade guided by platelets. What these platelets do is to send a group of signals to the stem cells, which are in a kind of hibernation. And when they receive these signals, they activate, develop, and carry out the regeneration process to obtain a similar tissue to the injured tissue. Many tissues in our body have high regeneration capacities, such as the skin. But unfortunately, there are tissues that have a very low regeneration potential, such as the cartilage. For this tissue that have a low regeneration potential, multiple therapeutic maneuvers have seen attempts, including the one with the greatest innovation and the one with the most promising result, which is therapy with the mesenchymal stem cells. These stem cells were discovered more than 60 years ago, but in recent years, most academic studies have been found that explain the usefulness in this type of diseases. Stem cells have two capacities. One is to transform into the injured tissue, and the other one is to release a large number of substances that control inflammation. In the case of David, I'm going to show you what's happening. We see there is a protective layer covering the bone end, which we call cartilage. To make it easier to understand, think of when you are eating a fried chicken thigh. There is a cap covering the bone end, which we call cartilage. In our body, we have the same protective layer between the femur and the tibia, and we have also a shock-absorbing structure called the meniscus. David experienced a meniscus rupture in childhood, leading to cartilage damage and osteoarthritis. Our traditional tools to managing this problem, like with David, were limited. Normally, the knee is covered by a joint capsule containing cells that remained dormant until stimulated by injury or other factors. We have developed techniques to awaken these cells, initially using platelet-rich plasma to stimulate those cells as we stimulated in an injury. Other methods like high-intensity electromagnetic therapy and laser therapy are also used. The goal is to activate these stem cells, but let's be clear, there is not stem cell therapy. Later came stem cells treatments, injecting more cells into the joint. These stem cells, typically dormant in our body blood vessels, so we can find them in any tissue of our body. But normally, they are sourced from bone marrow, fat, or umbilical cord tissue. Scientifically, studies show their safety and effectiveness in improving limb function, reducing pain, and promoting joint regeneration. The objective of the stem cells therapy is to transform these cells into the cartilage cells, repairing the damaged tissue. They also have potent anti-inflammatory effects. Over 7 years, we have seen encouraging results. In David's case, we started high doses of mesenchymal stem cells about a year ago. Like many patients, he experienced a significant improvement in his quality of life. David, right now, is able to return to his favorite sport, tennis, and feel better each day. If, like David, you want to improve your quality of life, we are here for you.